Hi, I'm Dr. George Rappard. Welcome to the Los Angeles Minimally Invasive Spine Institute and our new blog, the LA Spine Blog. In this blog, myself and a team of experts are going to try and answer some common questions that patients with spine pain and their families might have. We're going to get started right away by answering two questions. Number one, when should I see a care specialist for my spine pain? And number two, what kind of care specialists are there and who should I see? Spine pain, that is neck and back pain, is pretty common, and most people experience it at one time in their lives or the other. If it's so severe that it doesn't get better with simple measures like rest or non-steroidal anti-inflammatory medications like naproxen or Motrin or even taking Tylenol, then that's a sign that you may have sustained a serious injury to a spinal structure. You may have herniated a disc or you may have ripped a ligament. This can cause important problems down the line, and it's important to get your injuries documented and treated before further damage. It's also important to see a spine caregiver if you've been in an automobile accident and you have significant neck and back pain. For example, if you were rear-ended and you have significant neck pain, there's a 40% chance that you'll develop chronic neck pain. That is, there's a 40% chance that you'll have neck pain for the rest of your life. So it's important to get your injuries documented and have treatment initiated before your insurance claim gets settled. Sometimes neck and back pain is associated with something we call radicular pain. Radicular pain is when there is pressure or irritation of the nerves coming out of the spine. In the neck, this will manifest itself as a burning, deep, very severe pain radiating from the neck down the shoulder, down the arm to the hands. In the back, you can feel this pain radiating down the buttocks and down the leg, down the thigh to the foot. In the back, it's called sciatica most commonly. Nerve pain or radicular pain is very severe and commonly doesn't get better for a while without advanced treatment, such as physical therapy or certain specific prescription medications or even manipulation. If you have radicular pain and it's severe, you should see a specialist. Another reason to see a spine care specialist or an experienced spine practitioner is if you have any sort of neurological issues. So if you have any sort of neurologic compromise at all, you should seek medical attention immediately. If you can't do the things you want to or the things that you're supposed to, even if your pain isn't severe, then that's a reason to see a spine care specialist. What sort of spine care specialist should I see? What kind are there? There's various different types, and who you see is largely patient dependent. Commonly, patients will go to their primary care practitioners, their general internists, for example, who could prescribe muscle relaxants or stronger anti-inflammatory medications, could prescribe physical therapy, and maybe even order an MRI for you if you don't get better after a couple of weeks. A lot of people see chiropractors. Patients who have seen chiropractors for neck and back pain have very high satisfaction rates, amongst the highest in a recent review by Consumer Reports. Pain management doctors are doctors that specialize in pain, especially neck and back pain. Some of them even perform specialized spinal injections that can make patients feel better. Lastly, you can see a spine surgeon. But just because you're seeing a spine surgeon doesn't mean you're going to get spine surgery. Any spine surgeon worth his weight operates on far less patients than he sees. In other words, the majority of patients will never need surgery. In those cases, the surgeon is really supervising your care, sending you to the appropriate physical therapy, sending you to a chiropractic care for manipulation, or perhaps a pain management doctor for injections. And only in patients that don't get better on your own is surgery recommended. Remember though, surgery is a last resort and most people will never need surgery. Thank you for listening to our blog. We're glad you made it, and we hope that we have other interesting topics for you in the near future. If you'd like to know more about your condition or the types of minimally invasive procedures that could be performed to treat your condition, come to our website, www.laspinecare.com. Thanks for listening.